Alrighty, so here I am. My name is Ava Sarah Claire. Actually, that's my nickname, but and I am going to review the El Paso Community College guidelines for the medical imaging technology radiography program, addendum to health careers and technical education, math and science student clinician handbook revised for 2021-2022. It's 2024. It's not the same year, right? Like this year, so not the same year as this year. But it'll work for us to understand, just to kind of get a general idea of what this kind of thing is all about. So, what is this about? So, what is it about? Yeah. El Paso Community College District does not discriminate on basis of race, color, national origin, religion, gender, age, or disability. Guidelines for the medical imaging technology radiography program, addendum to the health career student clinician handbooks, table of contents. Welcome to the profession of radiography. We're just going to just jump right in. We're not going to read the table of contents. Okay. Welcome to the profession of radiography. Dear student, welcome and congratulations on your entry to the Medical Imaging Technology Radiography program at El Paso Community College. This publication guidelines for the Medical Imaging Technology Radiography program, along with the Health Occupation Student Clinician's Handbook, has been organized to familiarize you with the policies, procedures, and program information that will have an impact on your learning experience over the next 2 years. It is provided in your introductory course as both a required text and a reference while you are enrolled in the program. Please read it carefully and keep it in a safe place. You should refer to any questions, concerns, or comments about the content of this book to your instructor. Best wishes during the next 2 years. The program faculty: Professor Christy Thompson, MARTR, Professor Burham Gilbert, BSRTR, Professor Rafael Ramirez, BSRTR, CT Francisco Aleman, AAS, RTR, CT Lewis Cornell, BSRTR. Guidelines for the Medical Imaging Technology Radiography Program, addendum to the Health Career Student Clinician Handbook, 2021 to 2022. Equal employment opportunity. Did I just confuse those two words? Or just, I flipped them in my, never mind. Equal employment opportunity and equal educational opportunity. The El Paso Community College District recognizes its responsibility to subscribe to and promote the principles of equal employment opportunity and equal education opportunity. According to the recruitment, employment transfer, promotion, and termination of personnel shall be made on the basis of qualifications for the position without regard to race, color, national origin, religion, gender, age, disability, veteran status, sexual orientation, or gender identity, or other characteristics as provided by law. Moreover, the college will not discriminate against an employee or prospective employee on the basis of race, color, national origin, religion, gender, age, disability, veteran status, sexual orientation, or gender identity. The district reaffirms its policy of administering all of the educational programs and related supportive services and benefits in a manner which does not discriminate because of a student's or prospective student's race, color, religion, gender, national origin, disability, veteran status, or other characteristics as provided by law. Moreover, the college will not discriminate against a student or prospective student on the basis of sexual orientation or gender identity. So, program, vision, philosophy, and mission. MITR vision statement: the Medical Imaging Technology Radiography program at El Paso Community College is committed to advancing the profession of radiologic technology and meeting the community's needs by providing educated, certified, and registered radiographers. The program is committed to the concept of lifelong learning and promoting standards of clinical practice that will serve the students throughout their professional careers. MITR philosophy statement: the philosophy of medical imaging technology radiography program emphasizes the effective use of skilled human resources, contemporary facilities, and strong affiliations with community hospitals to enable students to develop their fullest potential. MITR's mission statement: the mission of the medical imaging technology radiography program is to produce competent entry-level radiographers that will enhance the healthcare community through the application of their specialized knowledge and skills. Okay. Guidelines for the Medical Imaging Technology Radiography program, addendum to the Health Career Student Clinician Handbook. Program goals and student learning outcomes: Medical Imaging Technology Radiography program 2021 to 2022. So the first goal, What is goal? Sorry. All right. The goal is students will be clinically competent. Student learning outcomes are students will demonstrate positioning skills. Students will formulate technical factors. Students will practice radiation. So when it says positioning skills, they're talking about positioning the client. When, as a radiographer, you have to position your client, your patient, to, proper positioning skills, because what if you're dealing with a patient that just can't move? You have to be able to position them, and also just in general position anybody in the right position to, position for the X-ray to occur on the proper region. All right, students will formulate technical factors. Technical factors meaning like on the computer, you look at the image, I believe, it's not just taking the X-ray, it's not just computer. So you have an X-ray, and then you're at a machine that you can move the X-ray around or whatever. Or you could you could activate the X-ray to turn on and do X-rays, right? So students will practice radiation protection. That's like putting the like a big sheet of iron on top of your client's genitals to protect it, in case they're pregnant, to protect their genitals, to protect their uterus from getting affected by the radiation. Goal. So yeah, if they're pregnant and they get an X-ray, then you would need protect that client to have protection so that their baby doesn't get affected with radiation. Something like that, yeah. Goal. Students will demonstrate communication skills. Students will demonstrate written communication skills. Students will demonstrate oral communication. So you have to be able to talk to the people that you're working with. You have to be able to jot down, their medical history and all that. So something like that. Goal. Students will develop critical thinking skills. So, student learning outcomes here is students will adapt standard procedures for non-routine patients. Again, let me read that again. Students will adapt standard procedures for non-routine patients. So I guess, I don't know what it means by non-routine patients. It probably means I can imagine patients that don't come on a daily basis, that just come, maybe it's walk-ins. I don't know. We as students will adapt to the ability to be able to work in an environment where clients are coming in, walk in, and it may not be on a routine, it may not be all the time. So we'll adapt to standard procedures for non-routine patients. Students will critique images to determine diagnostic quality. Yeah, so I actually didn't know that radiographers will do some image critiquing, because I thought it was the radiologist that did the image critiquing. So that's interesting. I'm thinking now, as I see this here, it's saying, I believe it's saying that, yeah, radiographers will be able to look at the X-ray image and be able to kind of tell a few things that, they may diagnostic quality. So I guess that, I see diagnostic quality. That means the ability for the radiologist to find it legible, to read for a diagnosis. I think that's the case here. Yeah, when you're, yeah, okay. Students require just to diagnostic quality. So yeah, I as a student will be able to look at an image and be like, okay, is it blurry? Do I need to redo the X-ray so that way it's legible for the radiologist to make a diagnosis? All right, so goal, students will model professionalism. Students will model positive work ethics. Students will recognize the value of lifelong learning. Okay. Program information. Students enrolled in the medical imaging technology radiography program hereinafter referred to as the program or by the acronym MITR are required to complete 21 months of combined didactic. Okay, so the word didactic, I looked it up, and it means designed or intended to teach. I found it very interesting for me that intended to convey instruction and information in addition to serving another purpose, and such as pleasure and entertainment. So this definition got me excited because I look back at this guideline here, and it makes me think that that this is going to be a good program. It's a program where they do hands-on teaching. They make it interesting. They make it fun, and I mean that's what I'm hoping for with any medical job, that, or any job that I do, that I actually make it fun, hands-on. It's not just like work, work, work. No, this is like fun, hands-on, and like the make you like make you feel like it's like you're in a movie, and then you're the actress, and then you're just doing your role, dude. Right on. Okay, I went a little off topic. I apologize. I did nothing wrong. I don't need to be sorry. I apologize. Okay, so are required to complete 21 months of combined didactic instruction. But yeah, didactic is a really cool word. It's like such as pleasure and entertainment, and convey instructions. That's from another purpose. So yeah, I have a good feelings. This word didactic makes me very excited about the program. But it could be that they're just going to teach and not make it fun. It's possible, so I can't get my hopes too high on that. Anyways, back at the ranch, are required to complete 21 months of combined didactic instruction and clinical training. Students who successfully complete the program will be eligible to take the national certification examination administered by the American Registry of Radiologic Technologists, ART. A-R-R-T. I've been saying so many times that I love art. I should not get my personal life involved with this. We are reading this, and we got to, I'm going to explain this. I shouldn't be explaining my personal ideas. So here we go. All right, American Registry of Radiologic Technologists. It may apply for certification with the Texas Medical Board. Actually, just let me explain. I love art. Like, I love ART, like creative endeavors, like, graphic design, Blender 3D, and, game. It's really hard for me to do programming, right? But I find myself that I love Blender, and I love Affinity Designer. I love, like, vector graphic software, and I like making 3D models, and also like, making like, animations when I can, if I have enough time for it. And I like, rigging is a hard part of, before the process of animating, but yeah. Anyways, yeah, I wonder if I could actually, like, somehow combine my job as, like, a radiographer, my future job as a radiographer, with Blender. I mean, wouldn't that be cool? I don't know, like, that would, I mean, I'm not just, make bones in Blender. No. What I'm trying to say is, I don't know. Like, imagine, like, being able to, like, do an x-ray on someone of their brain. But, like, okay, I don't think this kind of degree would offer, like, the kind of x-rays of being able to take brain scans, because this kind of radiography is more like the one that you move around. It's for bones, I think. I don't know if the brain would be, like, it's not an MRI. Maybe. I don't know. I don't know what to expect. But maybe it does. Okay. So yeah, what I'm trying to say is, what if, imagine that you do work for, like, an MRI, thing. You take scans of the patient as they're watching an animation. What is their brain process that's going on? What's happening in their brain as they're watching your visual graphics, your 3D graphics, That's kind of interesting. Anyways, that would be, like, the idea of combining 3D graphics with a radiography, in my opinion. My word, or my idea, so. But, anyways. So students who successfully complete the program will be eligible to take the national certification examination administered by the American Registry of Radiologic Technologists, ART, A-R-R-T. And I love ART. Sorry, I had to say that. And may apply for certification with the, I'm not sorry, I did nothing wrong. Okay. With the Texas Medical Board. The program is affiliated with Del Sol Medical Center, University Medical Center Hospital, the hospitals of Province, Memorial Sierra East and Trans Mountain campuses, and El Paso Children's Hospital. All clinical affiliates are located within a 20-mile radius of the Rio Grande campus. Accreditation. The program is accredited by the Joint Review Committee on Education in Radiologic Technology, JR CERT. The JR CERT is involved in the establishment of educational standards leading to program accreditation. Accreditation. As stated in its website, the JR Cert promotes excellence in education and elevates the quality and safety of patient care through the accreditation of educational programs in radiography, radiation therapy, magnetic resonance, and medical dosimetry. Nice. The JR Cert is the only agency guidelines for the medical imaging technology radiography program addendum to the Health Career Student Clinician Handbook. The JR Cert, the JRCERT is the only agency recognized by the United States Department of Education for the accreditation. Hold on, let me just make sure I'm actually recording. Oh, yeah, I'm okay. Oh, cool. All right. Recognized by the United States Department of Education for the accreditation of the traditional and distance delivery educational programs in radiography, radiation therapy, magnetic resonance, and medical dosimetry. The broad responsibilities of the JRCERT include the JR Cert, let's just call it that. Include consultation and guidance to educational programs and administration of the voluntary peer review accreditation process and radiography. Is it actually saying my voice? Is it saying my voice? We got to just test this out. I just want to make sure it's saying my voice. So testing 1 2 3, testing do re mi, testing 1 2 3, testing do re mi. Wait, I'm just looking at here. Never mind. Is it actually? I would not know. I thought it was. I'm not streaming. Okay, I'm actually recording. Good. Okay, I'm done. Okay, so I'm not done. I love myself. Okay, so the broad responsibilities of the JR Cert include consultation and guidance to educational programs and administration to the voluntary peer review accreditation process in radiography and radiation therapy technology, magnetic resonance, and medical dosimetry. The members of the JR Cert consist of radiographers and radiologists. The standards for an accredited educational program in radiography, published by the JR Cert, establishes the minimum accreditation standards for an educational program. The extent to which a program complies with these standards determines its accreditation status. This document can be found online at www.jrcert.org. Degree plan. Cool, this is important. The Medical Imaging Technology Radiography Program prepares individuals to operate radiographic equipment and prepares patients for various types of diagnostic procedures. So you as a radiographer will operate radiographic equipment, and then you're going to prepare those patients for a procedure, right? Yeah. The radiographer operates radiographic equipment necessary for any examination, positions patients, and determines proper voltage, current, and desired exposure for time for each radiograph. So when you're a radiographer, you have to be able to operate the machinery, and you're going to use the necessary equipment for you're gonna so you'll be able to operate the equipment for the exam, for their x-ray exam, and then you have to be able to position them in the right place, because some of these patients may not even be able to move. You have to position them, but also you just have to be able to position them on the table so that the x-ray can actually get a proper reading, proper scan, and determines the proper voltage current. So when you do voltage current, it's like you have to make sure that the voltage is correct, because if it's not, if you do too many rads, then that's going to be like you might wind up killing the patient. If you do if you do 100 rads or something like that, that might wind up causing them to get really sick, and then they die within weeks. If you do a 50 voltage of rads, then they might get some symptoms, but I think they can survive. I don't know. I still need to study this myself. So, anyways, but because I've actually looked into some radiography stuff, so that's why I know some stuff. I know some stuff. I don't know everything, but I know some. Anyways, back at the ranch. And voltage, current, and desired exposure for time for each radiograph. The radiographer is responsible for processing the image and maintaining patient records. So us as radiographers, we're the one at the computer. We position the patient correctly, and if they are pregnant, we make sure that we have an iron protection on them to prevent the fetus, the baby, from getting affected. Their fetus from getting affected by the X-ray, so the radiation of the X-ray. So you don't want, gotta make sure you have that protection so that their uterus doesn't get affected, or that their baby doesn't get affected. I believe so, yeah. The radiographer, I mean, it's possible that if you're pregnant altogether, it would probably not go through X-ray. No, wait. No. It's possible. I don't even know. That's a good question. I wonder if you could still have a pregnant client and still be able to go on with the X-ray. I think it's when you have I think it's when they're like in the beginning stages of pregnancy that you would need a protection. That's good. I just want to make sure. I just want to know, like, can you, my question is here, that I'm actually trying to say here is, like, can you actually do an X-ray on a pregnant woman, like 9 months pregnant or 8 months pregnant, or whatever, between the time frame of being pregnant. Anyways, like, 5 months to 9 months. Okay, my brain. I'm over analyzing. No, that's not the right word. I'm going on a tangent. Better calm down. All right. I went on a tangent the other day. Oh my god. I was actually studying some programming, and I found myself I was on a tangent trying to figure out what a colon was for, like, what does it mean in the GD script? And then somebody's like, "Are you okay?" And I'm like, I don't know. And then, so I wound up just studying something different. I just kind of jumped subject to something that I could be curious about, something else that I could be curious about in the GD scripting language. Yeah. Okay, anyways, so moving on. The radiographer is also responsible for processing the image and maintaining patient records. So yeah, you would be able to process the image, make sure that it comes out right, make sure it's legible for the radiologist, and the radiographer is also responsible for processing the image and maintaining the patient records. So yeah, and you would also know the patient history and all that, got to document what, everything is definitely confidential for every client. You don't want to be exposing all that info, everywhere. Because, if you have a client and they're pregnant, it's not like you're going to be telling all their family members that they're pregnant. It's confidentiality, it's just confidential. Sorry. All right, so, oh my god. The program curriculum includes anatomy and physiology, mathematics, fundamentals, and of radiographic exposure. Positioning. I'm just going to read because sometimes my brain just kind of overanalyzes things. I'm just going to read. And if I feel like I can explain something well, then I'll just explain. Okay. So the program curriculum includes anatomy and physiology, mathematics, fundamentals, and of radiologic exposure, positioning, procedures, radiation protection, image critique, and professional ethics. The capstone course for the AAS degree is RADR 2235 Radiologic Technology Seminar. So that's the last course you take. I just looked at this earlier a little bit, and I think that's an internship. Okay, non-traditional credit may be available. Students applying for an entry under non-traditional credit for any health program must meet specialized admissions requirements and ranking. Upon completion of the requirements for graduation, the successful graduate is eligible to apply for certification by the American Registry of Radiologic Technologists. This 21-month program is approved by the Joint Review Committee on Education and Radiologic Technology. Medical advisor. Oh my god. Medical advisor Sam Kupitz, MD. Students must complete specialized admissions requirements prior to the enrollment in specialized courses. It is ultimately the student's responsibility to submit all required documentation to allow for normal processing. Normal processing can take place in a few days or a few months, depending on the document type and individual circumstances. It is not reasonable to expect that the student will be ranked if documentation is not submitted in a timely manner. So you have to be on time with this thing. Pre-program specific requirements: background clearance, community-wide orientation conducted online, CPR certification at professional level, must be from American Heart Association, AHA, CPR, BLS, only healthcare provider training accepted. Military Training Network, AHA, recognized cards will be accepted, AHA. Hybrid AHA courses with live skills demonstration will be accepted. This would remain current throughout the course of the program. Certification may not be older than 1 year. HIPAA training conducted online, HIPAA. Positive titer. Teacher? Required for hepatitis B vaccination series of 3 and titer can take 4 to 6 months to complete if a student has started a hepatitis B series by ranking deadline. He or she may be cleared for ranking or registration with the understanding that the series must be a completed in a timely manner. Wait, what does it say? If a student has started a hepatitis B series by ranking deadline, he or she may be cleared for ranking or registration with the understanding that the series must be completed in a timely manner prior to starting clinical courses. Documentation of starting the series must be on file. Tuberculosis TB screening required annually. Note, it is highly recommended to complete any and all TB skin testing prior to receiving the MMR and or varicella vaccines. MMR or varicella vaccines would cause a false negative TB skin test result. Individuals who previously tested, so tuberculosis, yeah. Individuals who previously tested negative, have never tested, or are not sure if previously tested, initially feel like, do I really need to read this part? It's a lot of info. So part A, individuals who previously tested negative, have never tested, or are not sure if previously tested, part A, initial two-step TB skin test effective January 1st, 2018 for all students, faculty new to health programs. First one. Initial TB skin test, TST, administered in red 48 to 72 hours later. 2. If initial TST is negative, the second TST must be administered no sooner than 7 days and no later than 21 days after administration of the initial TST. 3. If initial TST is positive, do not administer the second TST. Individual needs chest x-ray, an annual TB assessment clearance, or equivalent document from healthcare provider. Number two of number one. Oh yeah, number 2. Okay. TB skin test positive previously requires completed annual TB assessment clearance form. Good. Positive titer. Teacher? I'm still questioning it. Required for each student. I should probably look it up because I might keep questioning it if I don't. Okay, so.
Titer.
The concentration of a solution is determined by Really? This is chemistry. Medicine. The concentration of an antibody is determined by finding the highest dilution at which it is still able to cause agglutination of the antigen. Let me read the chemistry definition. The concentration of a solution is determined by titration, the minimum volume of a solution needed to reach the endpoint of the endpoint in a titration. Okay, so positive titer required for each 2 doses: measles, mumps, rubella. I just, my brain kind of switches vowels and words. Like I'll be looking at a phrase and I'll be like, instead of measles, mumps, I'll say like mumps, measles, and then you just heard right now I said rubella. I almost said that. Yeah, so rubella. Measles, mumps, and rubella. Vaccinations MMR completed and titer. Positive titer. Required for each 2 doses: varicella vaccination and titer completed. Tetanus, diphtheria, and pertussis. TDAP completed. Expires after 10 years. Influenza is required or completion declination form done annually. Meningitis or booster effective January 1st, 2012, a bacterial meningitis vaccination is required for all entry students under the age of 22. The term entering students includes new students to APCC. Transfer students and returning students. Students must provide proof of an initial meningitis immunization or booster to admissions and registration department at any campus. The meningitis immunization must be administered at least 10 years before the start of the semester and must have been administered within the last 5 years. Note, after vaccination is administered, you must wait 4 to 6 weeks for immunity to show up on the titer. Current physical examination on EPCC form. No other form is accepted. Physical technical standard form. Post-acceptance requirements. So this is important. I mean, I found it important. All right, so I didn't read the whole thing. I know some stuff because I read some and, yeah. Anyways, post-acceptance requirements. Health insurance. You need your health insurance. Professional practice insurance, okay? Program orientation. So you need to make sure that you go to that program orientation before getting into the program. Specialized equipment and or lab supplies. So I guess like that would be like for your anatomy class. Whatever you need to do surgery. I'm sorry, this is not surgery, this is radiography. Whatever you need, gloves, tools, things to, like the tools to open up the dead frogs for anatomy, something like that. I assume they use dead frogs or fish. Substance abuse screening. You will be notified when to proceed. Do not start without explicit instructions from clinical coordinator uniforms. Transportation to off-campus clinical sites. Wait a minute. This is not biology. Hold on. No, in anatomy and physiology, of course they're going to use a real dead corpse. But they're dead. They're already dead. It's not like they killed them or anything. It just sounds so graphic. Oh my god. Okay. But yeah, anatomy and physiology, they will use real human corpse. I think so. Or they might even use an equivalent, like something that looks similar to a real human brain. I don't know. I don't know what to expect with this anatomy and physiology course. All I know is that I'm reading. Yeah, let's just keep reading because I gotta understand the guidelines for this degree. Anyway, so specialized equipment and or lab supplies, substance abuse screening. You will be notified when to proceed. Do not start without explicit instructions from clinical coordinator. Uniforms. Transportation to off-campus clinical sites at students' expense influence of vaccination. A tracking system, Complio, is used to assist students and coordinators alike to be compliant with immunization, CPR, physical, etc. All health program students must participate in the system to maintain their clinical data compliant and updated. Price and web registration will be provided. The Complio instructions may be found in the clinician's handbook. Health insurance to include hospitalization is required for students doing clinicals at healthcare facilities. In order to complete the requirements for progression and graduation, students enrolled in this program must have a grade of C or better in all specialized courses. The term specialized courses refer to all courses carrying the prefix of the program in which the student is majoring, or the prefix of another health-related discipline. Following completion of the Associate Applied Science degree, a multidisciplinary enhanced skills certificate of completion in border health issues is available. This program prepares graduates to work as members of a multidisciplinary team to meet the unique health care needs of the U.S.-Mexico border community. Is it really 2:12 on my clock? Yeah, it is. Oh. All right, so getting into the nitty-gritty here. This is the course that you need to have a B in. I know because I read somewhere specifically for my community college. You need a B in these courses. A B. But all the other courses, wait, I kind of want to verify. Yeah, no, I think. So pretty sure you need a B in this one. All the other courses, you need at least a C. C. Oh wait, this could be also that one that you might need to be in too, because it's the important one. Radiologic Technology Center. Alright, so, yeah. I'm actually going to stop the video right now because I gotta just kind of I gotta take breaks. So, we go back to talk about the courses. In the next video, we're going to talk about the semester courses that are required for the radiography degree. And then we might even cover on some textbooks. Yeah. I was like questioning why do they have like this second semester stuff when they could have added they could have like combined it here, they could have like put it all here, but I guess it's because these are like the main classes and then they have like these other classes that you can take in the second semester. I guess these are probably like optional. I don't know. I don't know why they separated it. Nevertheless, interesting. We will talk about the courses for radiography in the next video. All right. I will see you in the next video.